Welcome to the Peter Madison Rheumatology Centre Education Day for people with inflammatory arthritis. I'm Margaret, one of the rheumatology nurses.
Hello, I'm Matthew Williams. I'm a rheumatology physiotherapist.
Hi, I'm Helen Williams, podiatrist.
In the Peter Madison Rheumatology Centre we work as a multidisciplinary team, MDT for short, and this includes in the education group where all members of the MDT, apart from the consultant, will be present. MDT means that we can get together on a regular basis to discuss patients' care, to give holistic care and the best care possible for that patient's needs. The overview of our education is as in the plan here. We're looking at autoimmune arthritis versus osteoarthritis. We're looking at the structure of a joint, medications types, what to do in flares, managing related conditions, joint health and practical management, exercise benefits and types, because a lot of the treatment is not just the medication, the exercise and the therapies are just as important. Overcoming symptoms such as fatigue and low mood, pacing activities and doing exercises, and also what we can offer for yourselves, how to self-manage your condition, which is very important.
So a joint comprises of where two bones meet, so here and here. Lining the surface is cartilage, which provides a nice smooth surface for the joint to work in a nice smooth manner. We also have a capsule which surrounds the joint, which is lined with a synovium. This produces synovial fluid which lubricates the joint. We have ligaments which are over the top of the capsule, which come from here to here, which provides stability to the joint. Surrounding the joint we also have muscles with tendons what cross the joint, which also provide stability. We have the tendon lined with synovium also, which provides lubrication for the tendon to glide efficiently as the joint is moving.
There are two types of arthritis. There's the autoimmune arthritis or the wear and tear arthritis. The wear and tear arthritis is osteoarthritis, which everybody will get at some point in their life. And osteoarthritis, as it says on the slide, is low-grade inflammation not linked to the autoimmune system. In autoimmune conditions, this is where, for whatever reason, the immune system has been switched on and unfortunately has not switched itself back off again, and continues producing inflammation which will attack the joints. So autoimmune conditions are rheumatoid arthritis, psoriatic arthritis, inflammatory arthritis. And the difference between psoriatic and rheumatoid: in psoriatic, pain and swelling and stiffness can affect small joints like the hands and feet, elbows, knees and neck, as in RA, but also affects the spine, the soft tissues, the tendons, insertions around the joints, especially with people's feet or hands. Psoriatic can be really problematic. So what is the difference? In osteoarthritis, mainly restricted to joints, wear and tear, or as some people say, old age arthritis. Generally affects older people, pain restricted to affected joints, usually asymmetrical, steady progressive joint pain. Treatment not so complex, tends to be physiotherapy and analgesia. Stiffness generally occurs later in the day, whereas rheumatoid or psoriatic arthritis is a systemic whole body autoimmune condition, affects people of any age, both young and old, can be whole body pain, generally symmetrical in joints plus numerous other symptoms. Fatigue is one of the main symptoms that people tend to suffer. Treatment is often complex and morning stiffness can last longer than an hour.
So what happens when we have an autoimmune reaction and we have inflammation? The joint can be affected. So what happens is the synovium lining the joint produces extra inflammation which damages the joint. This can damage the cartilage surface, so it becomes rough. The extra swelling will stretch the capsule, and because you have reddening, pain and stiffness and swelling, as well as the joint capsule becoming stretched and you're in pain, you're not wanting to move as much, so the muscles become weaker, so the joint does not have the support it needs to provide stability. The general ligaments are slackened, so when you put forces through the joint, there's potential for instability and joint deformity.
People often ask what's the difference between non-steroidal inflammatory drugs and our DMARDs therapies, and DMARDs is disease-modifying anti-rheumatic drugs. Whereas an anti-inflammatory just dampens down the pain and inflammation in the body that is causing the pain, the DMARDs are there to actually treat the condition. By using the DMARDs, it's basically dampening down your immune system from producing the inflammation, which the inflammation will cause the joint to be painful, swollen and tender. So non-steroidals are basically there for symptom control and often have to be taken with a tablet to protect your stomach, because they can cause stomach irritation if taken long term. Whereas DMARDs tackle the underlying autoimmune cause of the inflammation, and these can take several weeks or months to work. And that's really important for patients undergoing this therapy, because in that time it takes for the drugs to work, you are able to take painkillers, including anti-inflammatories. So again, this is about managing your conditions, so managing relating conditions. With inflammatory arthritis, people are more likely to get other conditions such as cardiovascular disease. So it's really important that you help yourself, and this is something that the doctors, nurses, physios, etc. cannot help you with. So you need to have a good balance between rest and exercise, and make sure that you're having regular physical exercise. Have a healthy weight, BMI. Try not to smoke, because we know the only link with inflammatory arthritis is smoking, and patients don't tend to do as well as non-smokers with the medication or the disease. Only drink the moderate amount of alcohol and keep to within the normal government limits. And also your feet are really important because they're carrying your full body, so always make sure you wear appropriate supportive footwear. This is a really important point, especially if you are a smoker and suffering with an inflammatory arthritis. Smoking alone increases your risk of cardiovascular disease, i.e. heart attacks, heart disease, etc. Smoking can also reduce the effectiveness of the actual medications we are giving you. And RA, rheumatoid arthritis, is more severe in smokers than in non-smokers, and also you are more at chance of developing a rheumatoid arthritis if you are a smoker than a non-smoker. We have got help with Stop Smoking Wales. We are very lucky in the country we live in, as all the support is provided free of charge. It's something that can be accessed with the numbers here, and it can be also accessed through your GP, and you can self-refer yourself.
So as part of self-management, it's important that you have a good healthy diet, and we often get asked the question, what is a good diet? The National Institute of Healthcare Excellence, NICE, says there's not a lot of evidence surrounding exactly what we can tell about diet linking to inflammatory arthritis. But Arthritis Research UK does recommend that we have a good balanced varied diet, a more Mediterranean style diet with lots of omega-3 fatty acids and saturated fat is really helpful and important. Not eating too many processed foods high in salt and sugar.
So what are flares? Well, flares can be triggered by you overdoing things, i.e. too much gardening, too much housework, too much painting and decorating, even too much exercise sometimes, poor sleep, stress or infection. Symptoms will normally resolve in time, and occasionally there's no trigger and symptoms may not settle on their own. Okay, so what to do when you're having a flare? Take regular painkillers or anti-inflammatories. They can be taken together as long as you take them as prescribed. Try hot or cold to the joints. It could be a hot water bottle wrapped in a tea towel, a bag of frozen peas wrapped in a tea towel around the joint. See which is the best for you. Try relaxation or meditation. Balance rest with exercise. It's very easy when in pain not to exercise at all, but that is the wrong thing to do. Gentle exercises with regular rest is the best thing for your pain. Talk to family and friends or even your employer. Explain that you're having a flare. See if they can burden loads, etc., or help you with adjusting your work pattern. If flares are frequent or prolonged or severe and not resolving with the appropriate actions we've just given you, you need to contact the rheumatology team, and this can be done via our rheumatology advice line. Your treatment may then need to be adjusted or changed, but we will look at your flare and your history and make the appropriate action.
Hi, my name's Donna and I'm the team's occupational therapist. So occupational therapy is a diverse profession and we look at how people manage their activities of daily living. So a definition that I've got here is that occupational therapy enables people to achieve health, well-being and life satisfaction through participation in occupation. So what are occupations? Well, they're everyday activities that bring meaning to our lives. And what's meaningful to one person might not be meaningful to another person. So it's important that we look at what's meaningful to you as a person, and that's why we try and be as client-centred as possible. When we look at the activities, we think of them in three main groups. So self-care, so that's how you look after yourself in terms of getting yourself ready in the morning, being able to make a meal. We'll look at productivity. It might be going to work, or it might be a productive role that's productive to you. And finally, the leisure side of things as well. So what we do in terms of our leisure activities. And they're really important because they help to improve our quality of life. As an occupational therapist, we tend to look at your physical needs, your psychological needs, your social needs, so who you've got as support in your social group, and also look at your environmental needs as well, because the environment can have an impact on how we can do our day-to-day activities. So within rheumatology, occupational therapy does tend to focus more on hand function, because the hands are very important for us to do our day-to-day tasks, as you can see from some of the slides I've got up on here, the things that we do day-to-day. And we tend to take our hands for granted until they start getting sore or we get pain, and then we realise how much actually we depend and how much we use our hands on a day-to-day basis. So in terms of occupational therapy in rheumatology, I'd be looking at how we can help keep your joints healthy, looking at how to improve your hand and your wrist function, how to help manage things like fatigue, because that can be a symptom that's quite often difficult to manage, and an invisible type symptom as well, so looking at planning and pacing activities. Patient education as well, it's important that the more you know about your condition, the better you're able to self-manage your condition as well. Splinting, so we're able to make splints, custom-made splints, and different splints as well to help support joints, and I'll go into that a bit more in detail later. And we're basically wanting to maintain your functional independence, so we want to keep you as independent as possible and doing the things that is important to you as an individual. And we also look at work as well, so being able to do your work is very important, so we look at supporting you and things that we can put in place to support you to be able to go to work without any difficulties. Okay, so one of the aspects I was mentioning was how we help look after the joints in our hands, because we tend to put a lot of strain on the hands in general because they're very small joints, and day to day they have a lot of pressures that go through the joints. So it's looking at how we do things day to day really. So it's important that we're keeping active, and it's important that we're able to do all the tasks that we want to do day to day, but it's really thinking about sometimes how we do things, because usually there's always a different way of doing a task. So we're not saying not to use your hands, we're saying it to look at how you use your hands, and is there a different way that maybe you can put less strain on certain joints. And we know that that helps because looking after joint health helps to reduce pain. So if we're looking at how we're lifting things, It might be things at work, it might be how we're lifting the grandchildren, lifting a saucepan, the practical things day to day that we do. If we do that in a more joint health method, it's actually going to give us less pain in joints. And also what we want to do is to reduce the risk of developing deformities in joints as well, because certain pressures, especially repetitive type pressures on our hands, can actually sometimes put too much pressure on some joints. But the medication these days as well, is important to note that is really important, and we're seeing less and less deformities these days than we were 10, 15, 20 years ago. And again, it's maintaining independence, and that's what we're all about. We want to keep you as independent as possible as an individual. So these are the type of deformities that can occur, but really again, it's not as common as it was years ago, because the medications are now helping to fight inflammation a lot better than years ago. So there are some changes to the wrist that we can see. There's some changes that we can see in fingers. But then again, this slide really is a worst case scenario. We don't tend to see as much these days. But if we're mindful of what we're doing day to day and helping to reduce these deformities, it's going to be beneficial in terms of our hand function. Okay, so how do we look after a joint? We tend to call it joint health. We don't call it joint protection these days, because we don't want people to think that they have to protect their joints and not use joints. So it's about just using your joints in a more ergonomic and a more sensible way, really. So it's important to balance rest and activity. So it's thinking about, can you think about how you're doing tasks, and that you are factoring that you have short rests, possibly if you're doing things in the garden, that you're not doing a full day in the garden. It might be that you take short rests and come back to a task, and that you're just changing the type of tasks that you're doing as well. It's important that we exercise the hands as well and the wrists, and that we're maintaining the range of movement, and I'll go into that a little bit more in detail later as well. But we should be exercising in a pain-free, okay? We shouldn't be pushing the exercise where it's very painful. And if we can think about reducing the effort as well, so if we can reduce the effort that's on a joint and in the hands in general, it's going to be beneficial, because there's going to be less stress being put on the ligaments and that joint in general. Okay. So we want to be avoiding positions of deformity as well. So it's things like trying to avoid sweeping the hand over towards the little finger when we're opening jars. Think about how we're lifting things. Are we keeping the wrist in a nice neutral alignment when we're lifting, not tipping over too much? Because we want to reduce really those type of movements if possible. And are we able to use larger joints for doing tasks as well? So quite often people will tell me that they carry bags maybe on the fingers, and then that tends to put a lot of pressure on the little joints again. So an example might be carrying your bags on your forearm, opening a door using maybe, or closing a door with your hip rather than using a wrist movement. And there's also the use of adaptive equipment as well, and they have a really important role to play, because again it will reduce the stress going through joints. So it's not looking at cheating or using something that's not going to be using the hand. It's really being sensible and using things like maybe electric can openers or gadgets to open things like new jars, things to help you grip things easier. So we're not compensating for hand function. What we're doing is trying to reduce the stress going through the joints in the hands. And it's really important to respect your pain as well. So if a task does give you pain, is to be mindful of that you are actually taking that into consideration and stopping and having a rest. And what we'd advise is that you actually stop before you actually get pain when you're doing something. For instance, if you were to do an activity and you might be ironing and you might be doing that for half an hour and that brings on the pain, we would say that you to stop that before, maybe after 20 minutes before the pain then sets in. So that's a sensible way of using, keeping active, but then again, respecting your pain as well. Okay, so it's really, the joint health is a very practical side of things really. It's looking at how you're doing things. So it's really, when you're doing tasks, we all do things differently. So it's really looking at how you're doing something and thinking, is there a different way that I can do this that's going to put less pressure on these joints? So we've got an example here of how you would lift a kettle day to day. So it might be that rather than using one hand, I'm probably strong enough to be able to do that, but to use both hands, because then you're actually sharing the load between both hands. The same with how you're lifting things like using your cup, so that you're using, if you're putting a lot of stress on the little joints of the hand, can you support it with another hand as well? And that will help to ease the stress on that joint as well. Thinking about how we're carrying things, trying not to carry things like plates like this, because that tends to put a lot of stress on the thumb. So think about using your whole palm to carry things, because then it'll spread all the load over the hand. So it's really it's looking at how we're doing things, stopping, looking and thinking, right, how can I do this differently? Because there is always a different way of doing something. Okay, so again, it goes into how can you spread the load across more than one joint. So we've got an example here of somebody carrying a haversack. So rather than just using the haversack on one shoulder, we'd say, well, use both the straps on the haversack, and that will then distribute the load across the shoulders and the back. As I mentioned, keeping as much of your hand in contact with the object as possible, and avoid gripping with the thumbs, as I've mentioned as well. And using the joints in a more stable position is thinking about things like using your wrist and keeping the wrist in a nice straight alignment, okay, and reducing stretching and bending and those type of positions as well, because that will put more stress on the bigger joints as well, not just the hands. And again, if we are carrying things, can we carry things closer to the body? So if we're carrying things like your laundry, or you might be carrying things to work, try and carry them close to your body, and carry them on your forearm rather than lifting them on your fingers. And they're just a few examples of things that you can change day to day. And it's good to get into the habit of doing this really from the beginning. And people do tend to change how they're doing things because of pain. Naturally, we'll hold something differently if a joint is painful. But really what we want to do is to try and get into the habit of doing that all the time. Yeah. And that's where we come into really changing habits of a lifetime, which are quite difficult. So you want to watch how you're doing something, identify, so see how you're doing something, practice a new way of doing something, new way of lifting or carrying something, and then you can develop your new habit then, which will become second nature. And then if you do have a flare or you have difficulty with your joints, you're already doing that the joint health side of things. Okay, so hand exercises are very important to try and maintain the movement in your hands and your wrists. And that will also help with reducing pain, reducing stiffness, and also reducing swelling, because the swelling as well will help to be moved around if you're actually exercising the muscles in your hand. So we're looking at maintaining and improving range of movement. So the range of movement is basically how much movement we've got in the joints. And what we're aiming for you to be able to do is to be able to close your hand fully into your fist, into a fist. Looking at dexterity, so those little movements that we do day to day, things like closing buttons, picking things up like coins and things, that will help with that side of things as well. And we're looking at grip strength as well, so how much power we've got in the hand. We know from research that if the grip strength is low, that people then tend to have difficulty doing day-to-day tasks because the power isn't in your hands. So there's different exercises to work on different things. So there's range of movement exercises to work on the movement, and there's also the strengthening exercises to work on strengthening the muscles. What we also know is that if the muscles are nice and strong, it helps to support the joints, and that helps long term in terms of looking after the joints, keeping them healthy, and for you to be able to do more of your day-to-day tasks without difficulty as well, which is what we're aiming for really. Okay. So people quite often will ask, well, how do I exercise my hands? As a basic rule of thumb, really, we'd always start with the range of movement. So if the movement is restricted, we need to work on the movement before we actually work on the strength. Because if you can't close the hand fully, it's going to be difficult for you to do your day-to-day tasks. So it's important for the movements to be nicely slow and controlled. So by doing really quick movements like this, it's not actually giving the tissues time to have a good stretch and to work things effectively. So we will give you a hand exercise program that will work through all the joints in the hands. But really it's thinking about starting from a straight position like this. You can bend down to actually bend the MCPs here, which are these joints here, bending back up, and then you can bend the middle ones, what we call the PIPs here, stretching them back up, bending the little end ones, and then trying to make a full fist. Okay, and nice and slowly with those rather than doing them really quickly. So we want to work each joint through its range, and the thumb, it'd be useful to bring the thumb over to the base of the little finger and try and bend it that way. I'll bring it back out. And another good one to do is to work on the wrist, is to actually just bring the wrist down, bring the wrist up, bring it back to the middle, and try and bring the palm over that way and back that way. So they're really good ones to start off with. So we'd always build up slowly, gradually build up as you're able to. And as I was saying earlier, we then tend to work on the strength when the movement has improved. Okay. So do's and don'ts, as I was mentioning, important to do them in a nice, slow, controlled manner. And it's important to do them regularly during the day as well. So doing the exercises once a day, unfortunately, isn't going to be sufficient. So we tend to advise to do them at least 4 times a day. So it might be that you do them in the morning, lunchtime, tea time, and before you go to bed. Just to be doing them regularly will help reduce the stiffness and the pain, and help with the swelling if you've got swelling in your joints as well. And it's important that you follow the exercise regime that's been given by your therapist, because there might be different ones that you need to be doing for your hand function. I get a lot of people asking me about using a ball for exercising your hand, and we don't advise that you use a ball to do that. The reason is, if we've got a ball in the palm of our hand, it will actually stop us from being able to fully bend fingers into the palm. So it's better just to actually try and make the movement without something in your hand, no object or anything like that. Also, if you've had a really busy day and you might be been using your hands a lot during the day, it isn't the same as actually doing structured exercises with your hands. So you'd still need to be doing the exercises, because the tasks that we do day to day don't normally put our joints through that full range of motion. It's important that we're doing those alongside that as well. And when we think about how many you're doing, it's important that you're counting as well, and keeping a track of how many you're doing, because then if you want to progress and actually build up on those exercises, you'll know how many you've done. And that's especially true with some of the strengthening exercises as well, because we can use things like therapy, which is a putty that you can use in your hand to do specific exercises for strengthening. And it's important that you do count how many you're doing so that you can progress how many you're doing, because if we stick to the same amount when we're doing strengthening, we're not going to be working those muscles as good as we should be, really, to strengthen things up. Okay. So we're also able to do splinting to help with function. Okay, so a splinting really aims to support a joint so that you're able to do a functional task, and there's lots of different types of splints. So we've got lots of off-the-shelf type splints that we order in, and we can also make splints to fit your hand as well, and we make them from different types of thermoplastic, and we make them by making a pattern of what type of splint we need, and then we heat up the plastic and we mould it to your hand, and then that's going to fit you, then it's going to fit your hand perfectly. So splints can help reduce pain, they can help to reduce deformity, and they can help to rest structures as well when we need to as well, such as, for example, if somebody had a tendonitis, something like that, so inflammation in a tendon, and a tendon attaches a muscle to a bone. And you can also get inflammation in the tendons, not just the joints themselves. And it might be that we want to let that tendon have a bit of a rest, really, so it's not getting more inflamed by the movement that's occurring day to day. We'd only splint when we feel it's appropriate. Okay, and we won't splint unless we feel there's going to be an improvement or a gain in your hand function. And as I was saying, really that's very individual to each patient. It depends why you're splinting, but it does tend to be a functional splint rather than a resting. We don't tend to do resting overnight splints anymore because we don't feel that they are needed with the medications these days. It might be a splint that you want to use at work or when you're doing your day-to-day tasks if you're having specific difficulties. Taping is another thing that we're using more often these days as well, so the kinesiology tape as well, so that's something that we're using for certain joints as well, so that's another option these days as well. Okay, so it's also important that we look at how you can manage to do the productivity side of things, so in terms of your work, because a lot of people are concerned whether newly diagnosed how they're going to be able to do their work tasks. Are they going to struggle with certain things? And that's often an anxiety people do bring up when we see them. And there's lots and lots of research now on the benefits of being able to do your work and how it has an effect on you in terms of your self-esteem, because we know that if you're able to do your work, it will help improve your self-esteem, and that can help to lessen depression, lessen your pain, and help to reduce isolation as well because of the social interaction of you going to work and seeing different people and colleagues, and it's really beneficial as well of helping you to keep active, because that's really important that you're keeping active with your arthritis. So occupational therapy can help support with any work-related difficulties as well, such as thinking about how you're using your joints. It might be advice on certain work activities that you do. Is there a different way that you can do things to help?
Exercise is really important in your self-management, taking into account your present fitness levels. Exercise can benefit anybody, and it's really important that you consider starting to exercise to manage your condition. So rheumatology physiotherapy. As part of the rheumatology team, we provide exercise prescription advice. We offer one-to-one assessment and treatment as and when required. So say you've got a particular problem with a joint, we can offer assistance with that. Also we provide group exercise where you can come into the hospital and do a programme of exercises under supervision, which will hopefully give you the confidence to continue to exercise at home or in the community. There's a lot of negativity often surrounding exercise, but we want to try and explain that exercise can be really beneficial and barriers to exercise can be overcome. So we're looking at the positive aspects of exercise. So by exercising, you're going to increase your flexibility, increase your strength. Because the joint's more supported, you're going to be in less discomfort. Because you're in less discomfort, you're able to do more things. There's less avoidance of activities. Because you're doing more, you're going to get fitter, have more capacity to do things. That's going to reduce your pain. So we're looking at a positive cycle, what's provided by exercising. What we want to avoid is a negative cycle, where you're in pain, you're frightened of moving, there's a lot of fear and avoidance of moving, which is going to lead to more joint stiffness, reduced strength, further avoidance of activities, and reduced overall fitness and capability of doing things. And because you're stiffer, you're going to be in more pain and discomfort. So we want to avoid that negative downward spiral. So the main type of exercise, so there's 3 main elements of exercise which are really important to do when you have inflammatory arthritis. So we want to prevent stiffness, weakness and fatigue. So the first important aspect is stretching by doing range of movement exercises. The second thing is strengthening, trying to build up muscle strength so your joints have lots of support. And we call that progressive resistance exercise. And the third thing, part of the main elements of exercise, is to increase your stamina. So exercise will increase your heart rate and increase breathlessness when you're doing it. There's many different types and forms and combinations of exercise which will provide those benefits. So cardiovascular, strength, flexibility. You're fitter, you'll get better balance and coordination. So the importance of exercise in arthritis. Going to have reduced stiffness and improved range of movement. Less muscle wasting, you can have better strength. You can have more support for your joints. The structural support of the joint is going to be improved, so you're going to be in less pain and discomfort. Because you're thinking about how you're moving, you'll be more aware of your posture, so you're not going to be in position to discomfort, and your general mobility is going to improve. Another important benefit of exercise is going to give you good bone health. It's going to offset any bone thinning. It's going to give you more energy. It's going to feed into your energy bank and give you more stamina. By being fitter, you're going to have more self-confidence, and that's going to help maintain your independence. Exercise is really important, and the different types of exercise are important to achieve what we want to achieve. So for cardiovascular exercise, the recommended amount is 150 minutes a week. You can split that into 5 times a week of 30 minutes of exercise. Importantly, with inflammatory arthritis, we want to keep our muscles strong, so we do something called progressive resistance exercises. They're the type of exercises which strengthen our muscles, and we should be doing them 2 to 3 times a week. We try and aim to exercise most of the major muscle groups, and we try and do between 8 and 15 repetitions. If you can't do 8 repetitions, it might be a little bit too difficult for you. You might want to make it a little bit easier for yourself. I'm going to demonstrate now some basic chair exercises which you can do at home and you don't need any equipment. So the first one is what we call a knee extension. It's to build up and strengthen your thigh muscles. So straighten one knee out, hold for 5, tense your thigh muscle. Down, straighten out, hold for 5. Down. And you just go 4th like that until you do at least 8 on each side. What we try and aim to do is functional exercise as well, and really good functional strengthening exercise to stop muscle wasting is simply practicing sitting, standing from a chair. So what you can do is shuffle towards the edge of the chair, fold your arms, remember to lean forwards and to stand up nice and tall, and then sit back down slowly. So the amount you can do is going to obviously depend on how well you're managing, how much discomfort you're in. So try and set little targets and try and achieve those. So if you're struggling, it might just be 2 or 3 in a row, but hopefully you'll be able to get up to that 8 mark and progress it on to further repetitions. So the next exercise you can do at home, just using a chair in front, is also to build up lower limb muscle strength, is what we call a small knee bend. So using a chair for support if you need it. feet level, pointing forwards, try and keep your back straight. Bend your knees down. Hold for a count of 5. Okay, and then come up. We're going to try and repeat that at 15 times if we can. If you can only make it to 8, that's fine. So you'll be able to feel your thigh muscles working, also your bottom muscles. Okay, and come up. Don't be tempted to go down too far. You should try and keep your feet flat on the floor. So this is going to help you when you're trying to bend down to pick things up, from low cupboards, and also help within a range of muscle strength in your knee, which is going to help reduce knee pain. Right, moving on to upper limb exercises. I'm going to show you 2 basic ones. One's a simple arm curl. A couple of important things to mention here is to protect your wrist and your small hand joints, try and keep your wrist straight when you're doing this. Again, you don't need any equipment, but what you can use is, for example, baked bin tin cans, for resistance, or water bottles. But a lot of people have hand weights, which I'm going to use. So, bicep curl. Okay, so again, aiming between 8 and 15 repetitions. Keep your elbows by your sides and just curl the weights up. Okay, pause and then come down slowly. Try and keep your wrists nice and straight when you're doing the movement. And my arm muscles working. Okay, so I think I've done 10 there. Okay. So moving on to a nice shoulder stretch, upper limb stretch, or whole upper body stretch. Good start moving is putting your hands on a table when you're sitting in front, sliding forwards as far as you feel comfortable. So as you're a little bit stiff, you might not be able to go right down, but as you loosen it, you might be able to get a little bit further. Again, aiming to do between 8 and 15 repetitions. So eventually, you'll be able to get right down. It might not happen, straight away. It might take a couple of weeks to be able to get some movement. So you just go as far as you feel comfortable. But what we're doing here is providing your arms with lots of support. So if your muscles are weak, they're getting that little bit of help they need. So that's a nice warm-up exercise to do, or an early stage exercise to help get your upper limb and even your back moving. But moving on, we can add resistance. So again, using tin cans or water bottles, or even dumbbells if you've got them. Holding them in your hands, again, trying to get into a nice comfortable position, trying to keep your wrists straight. Try and lift up as high as you can go, then back down. Try and keep your back straight. You can do this in standing, but sitting if you need to. Again, try and do a nice slow controlled movement. Feel my arms working. So, as well as encouraging you to exercise at home as part of your self-management, if you're newly diagnosed or need a little bit of help, we do an exercise programme in the hospital also called the Rheumatoid exercise programme, or REPS for short. It's an 8-week exercise programme where we do a circuit of exercises involving about 8 stations. It's quite informal, encourage you to take your time when you're exercising, and we can encourage you to exercise at home as well from that. When you finish the 8 weeks, we also offer referral on to community exercise programmes, including the National Exercise Referral Schemes run by council-run leisure centres.
Podiatry and foot health. Inflammatory arthritis can affect your feet. On diagnosis, a podiatry assessment will be undertaken. A referral will be made from the rheumatology department. In the assessment, your blood flow, which is a circulatory check, and your neurological status, which is a check of your nerves of your feet, will also be undertaken, as well as the shape of your feet to assess how they are now. Your footwear will be discussed and advice given on general foot health. Inflammatory arthritis affects generally small joints, so that's in the hands and the feet. Consider comfortable, well-padded footwear. Trainers are perfect. Check your feet daily for any signs of skin breakdown. Occasionally, if you've got inflammatory arthritis within a joint in your foot, it can develop callus over that and it can become painful. Remember, look after yourself and look after your feet. They work very hard.
Okay, so what is fatigue? As it says in this slide, extreme physical or mental tiredness, or even a combination of both, which can be really draining, especially when you're coping with painful stiff joints at the same time. So features of fatigue, well, your body and limbs feel really heavy. Flu-like feelings, like you feel completely exhausted, feeling like your energy's just gone away and drained away from your body, and also poor concentration. People say they have like a brain fog and no motivation, you just can't be bothered to do anything. So many things can be contributed towards your fatigue, and lots of things can be combined together. So you may have active disease, long-term conditions, pain, weak muscles. When we overdo things rather than pacing and thinking, can this be done another day? Sleep, it's a well-known fact. If you don't have enough sleep, you'll feel exhausted, fatigued, and generally have more pain. Stress, anxiety can affect it as well. Low mood, and that can be linked in with the stress and anxiety, and even poor diet can affect how we feel. So how can we help with fatigue? Well, we follow the 4 Ps. Problem solving. Look at your daily routine. Are you doing enough activities? Are you overdoing activities? Can you do it differently? Planning. Let's plan things, what we want to do in the day. Does it need to be done that day? Does it need to be done that week? Plan how we're going to do our activities. Splitting the activities, say over the day, so much in the morning, so much in the afternoon. Prioritising, do we really need to do it today? Is it essential? Is it essential we hoover the house from top to bottom every day, or can it be done once or twice a week? Exactly like I've just said, does it need to be done at all? Can you get some help? There's people out there to help you. Look at your family, look at your friends. Pacing, which is really, really important. Break down your tasks into achievable parts. Look at what you've got to do and try and break it down so it's achievable. Spread the activity throughout the day or the week. Rest. When you get tired, don't carry on thinking it's got to be done. Rest. Have 10 minutes, have a panad, have a drink, and then retake your activity. And it will be finished a little bit longer, but you will get your activity finished. So how can we help with fatigue? Well, we need to avoid the peak and trough. And if you look at your energy levels as you bank, what we don't want to do is you wake up in the morning, you feel fantastic, and everything gets done in that day, rather than pacing it throughout the day or the week. Because what tends to happen is then the next day you're weak, you're tired, exhausted, and in more pain. So we need to try and avoid these peaks and trough pattern. So how to improve your fatigue levels is to reduce the peaks and troughs. So instead of having it up and down, we have a more steady flow where you do so much in a day, you plan your pace, and then we don't drop down the next day, and then the energy is there for the next day. Pacing is the best way to achieve your goals. If you look at the hare and the tortoise, if we pace, we'll always get there in the end.
So how can I help my fatigue? Well, you need to deal with any stress or anxiety and reduce that as low as you can. Restore your sleep pattern. Ensure you go to bed at a sensible time. Increase your physical activity. Try and do those small exercises that we showed you earlier. Try and walk a little every day. And look at a healthy diet. Make sure you've got plenty of fruit and vegetables.
So to summarise our education down inflammatory arthritis, what do we need to do? We need to take our medications, but also, which is equally as important, we need to have a balanced diet. We need to look after our weight. We need to have a balanced lifestyle. We need work, play and rest. We need to take our medication. Stop smoking if you are a smoker. Look at your joint health. Look at how things can be carried out to protect our joints. Pace and plan. You need to plan your daily activities and pace. If you get tired, have a rest. It can always be done another day. Regular daily exercise is really important, and even when you're having a flare or really fatigued, still carry on those exercises because it will help in the long term. In PMRC Rheumatology, we will require you to complete forms like the 7-day pain, fatigue, arthritis and sleep form prior to your consultation. Now, it may be if you have face-to-face consultation, it will be done on the day, or if it's a telephone consultation, we may well send you these forms to fill in and post them back to us. We use these forms to basically assess your condition and assess your disease. In rheumatology, it may be that we need to change your treatment, it may be that we keep you on the same treatment, it may be that we reduce or even able to stop your treatment, and we use these as a guide to try and assess your disease. One of the forms we will get you to fill in is the visual analogue score, and this is how you feel your disease is. With lots of things we fill in today, like if we've been to a restaurant and they ask you to give feedback, it's always 0 is really bad experience and 10 is a really good experience. In rheumatology, the scoring is slightly different. It's really important that you're accurate in scoring of how you feel your disease is. So as the visual analogue score would be, if you've got no pain, would be 0, but if you've got the worst pain possible, it would be 10. In the next this is the 7-day score, and again, it's not like when you would score if you were given a review for a restaurant or a hotel. It's slightly different. So we would ask you in the last 7 days how your pain has been. No pain would be down here and the worst pain would be here. If you're in the middle, you'd put a line going like that. If you've got no pain at all, it would be more down here. The worst pain would be more up here. And we would put a line on, say, the graph as like there. Okay. Fatigue is the next one, which can be part of your disease. If you've got no fatigue, it would be more this way. If the worst fatigue, it would be more this way. Your arthritis, this is either your rheumatoid arthritis, your inflammatory arthritis, or your psoriatic arthritis, whatever you suffer from. Your arthritis is not active at all, would be more down here, and your arthritis is the really active it's ever been, would more be up to this side. Again, sleep, how you're sleeping. Is your sleep pattern good? Is your sleep pattern bad? So again, we asked in the last 7 days how your sleep's been. If you slept really well, it would be down here. If the worst sleep ever, it would be more here. Or if you're in the middle, for all of those, it would be in the middle, however you feel you've been in the last 7 days. It's important that we know if you're a smoker or non-smoker. So again, we would just ask you to circle if you're a smoker or a non-smoker. Thank you for listening and watching this presentation. We hope it helps in your management of your condition. Any queries can go through the Rheumatology Advice Line, which is a 24-hour answer machine. It is not answered 24 hours, but we normally get back to you between the hours of 9 to 5 on a working day, or you've also got your GP. There's going to be links at the end of this presentation which you can download and look at further at your pleasure.